Hi, I'm Dr. Kurt Woeller for the SIBO Mastery Course. The SIBO Mastery Course through Integrative Medicine Academy is a very intensive online course designed for healthcare practitioners to understand the core concepts of small intestinal bacterial overgrowth. There's 5 key modules in this 9-module course that's specific to information related to SIBO or small intestinal bacterial overgrowth. The remaining 4 modules get into other things such as Helicobacter pylori infections, parasitic infections, invasive candida, Clostridia bacteria, nutritional imbalances, and other types of digestive system disorders that could either create or cause SIBO or perhaps mimic SIBO. Because one of the things we've realized as practitioners now for many years is not everybody who says they have SIBO has it. You have to test to confirm it. And there sometimes can be many contributing factors to somebody's small intestinal bacterial overgrowth problems. One of the things I want you to keep in mind that often isn't discussed but is something that we are seeing clinically in practice and working with other practitioners related to SIBO is the potential for mold overgrowth in the digestive system. One of the tests that we teach to learn how to interpret in the SIBO Mastery course is an organic acids test, specifically the organic acids test from Great Plains Laboratory. Now we go through all of the SIBO testing. We go through metabolic assessment profile to understand protein digestion and liver function. We do gut pathogen assessment testing and analysis. All that's critically important. But the organic acid test is underappreciated in relationship to people who are suffering with SIBO, because many people with SIBO also have invasive candida. They can have Clostridia bacteria problems, and Clostridia bacteria more than just Clostridia difficile, but other types of Clostridia that produce neurotoxins that affect the nervous system. And our gut, the enteric nervous system, is part of the nervous system again. So there's a relationship between the gut and the brain and the gut, even in people with small intestinal bacterial overgrowth. But one of the other things that the organic acid test does is it provides some insight into potential colonization of the digestive system from mold. Aspergillus mold, penicillium mold, for example. And mold is invasive, and it can break down and affect the nervous system in the gut, affect the immune system in the gut, and that could also then potentially create some of the problems that many individuals with SIBO are experiencing. One of the other aspects of laboratory testing that we are now incorporating into the SIBO Mastery course is information on mycotoxins through what's called the Great Plains Laboratory Mycotox profile. And mycotoxins are mold toxins. Very important. And this has been an area that's not been, I think, well recognized, because a lot of the lab testing hasn't been out there in years past, but now we have it, and starting to run those kinds of tests, you can see some of the clinical correlations. These mycotoxins are not something assessed through a blood test. They're not assessed through stool testing, for example. And many of them are incredibly toxic, affecting liver function, kidney function. Some are carcinogenic. And there are also many of them damaging to the nervous system, brain, central nervous system, peripheral nervous system, and potentially the enteric nervous system as well. So a very unique part of this course, again, is moving beyond just small intestinal bacterial overgrowth testing. It's that plus how to assess these other tests as complementary assessments to start to dig much deeper for people who are struggling with this very complicated problem of small intestinal bacterial overgrowth. So read through the information about the course on the SIBOMasteryCourse.com, the website. If you have any questions about the course or specific questions about content, you can email us at SIBOMasteryCourse@gmail.com. So again, I'm Dr. Kurt Woeller for the SIBO Mastery Course. Thank you.